A girl is born prematurely at 26-week gestation. She is placed in the incubator and appears to be stable condition. During a cardiac examination on her second day of life, the physician heard a machine-like murmuring in the second intercostal space at the left sternal border. He prescribed indomethacin to eliminate the condition before complication arises. What is the embryonic origin of the structure targeted by this drug? So we have to understand that what problem this baby has. Okay, that the baby is suffering, she's premature. This means before 26. Why they mention 26 here? Because if the baby born prematurely at 26 week of gestation, then there is a chance of less surfactant, less production of the surfactant. So if less production of the surfactant, what happen in this condition? In this condition, the baby suffer hypoxic. The oxygen concentration into the blood, okay, it decreases. The oxygen concentration decreases. And the second point here is that the baby has some sort of machine-like murmuring in the second intercostal space in the left sternal border, and the doctor prescribed indomethacin, and this indomethacin is non-steroid anti-inflammatory medication. So I think that this baby is suffering from patent ductus arteriosus, because number one risk factor is oxygen, less oxygen, and number second is the patient gave the doctor gave indomethacin, and number third, that is machine like murmuring. It is a continuous murmuring. So in case if we listen some sort of murmuring, there may be diastolic murmur, systolic murmur, or machine like other continuous murmuring. So continuous murmuring is a murmur which not dependent upon diastolic and systolic, okay, it continuously occurs. So, and it is a feature of patent ductus arteriosus, okay, that like this, from the aorta to the pulmonary trunk. And during the birth, the blood flow is from here to the aorta, okay, it remain open in the birth, but after birth it should close, because number first, the oxygen, number second, the prostaglandins start to decrease after birth. So when it decreases, there is no further vasodilation and there is a vasoconstriction. Then this opening, it close and it form the ligament between the aorta and pulmonary vessel. But in this condition, what happening, that the patient is premature, low surfactant, low oxygen, high prostaglandins, which leads to keep opening of this ductus arteriosus. So the doctor prescribed indomethacin, which inhibit the prostaglandin, and finally it closed. But they ask about the which structure during the embryonic development finally help in the formation of this ductus arteriosus. So the structure which is responsible for the formation of ductus arteriosus is sixth aortic arch. Okay, and if you look the first aortic arch, then the first aortic arch contribute part of the maxillary nerve. Okay, it forms the maxillary nerve, so it is not an option. The fourth aortic arch give rise to the aortic arch on the left and the proximal right subclavian artery on the right. So it's again not contributing in the formation of patent ductus arteriosus. See the second aortic arch produce the stapedial artery and the thyroid artery, hyoid arteries. And option E is about this third arch give rise to common carotid artery and the proximal part of the internal carotid artery. So it's from the internal carotid artery, hyoid artery, okay, the fourth one subclavian artery, and the first one from the maxillary artery. So the sixth one is responsible for the formation of ductus arteriosus. Thank you.